Ventricular dysrhythmias. Premature ventricular complex, PVC. Abnormal impulses that originates from the ventricle and occurs early. Abnormal impulses that originates from the ventricle and occurs early. Abnormal impulses that originates from the ventricle and occurs early. Ventricular tachycardia, also known as VT. Rapid ventricular rhythm, 100 beats per minute. Rapid ventricular rhythm, 100 beats per minute. Rapid ventricular rhythm, at least 100 beats per minute. It's usually due to ischemic heart disease. Usually due to ischemic heart disease. Usually due to ischemic heart disease. VT can often deteriorate into VF. VT can often deteriorate into VF. VT can often deteriorate into VF. Ventricular fibrillation, VF. Rapid, ineffective quivering of the ventricles. Rapid, ineffective quivering of the ventricles. Rapid, ineffective quivering of the ventricles. Asystole, absence of any ventricular rhythm. Absence of any ventricular rhythm. Absence of any ventricular rhythm. Now we're on to heart rate, heart failure. Heart failure. Heart muscles does not pump enough blood to meet the body's needs. Signs and symptoms, left-hearted heart failure, results in pulmonary congestion. Results in pulmonary congestion. Results in pulmonary congestion. Signs and symptoms, dyspnea and crackles. Dyspnea and crackles. Dyspnea and crackles. Fatigue and pink frothy sputum. Fatigue and pink frothy sputum. Fatigue and pink frothy sputum. Right-sided heart failure. Result in systemic congestion. Result in systemic congestion. Result in systemic congestion. Signs and symptoms. Peripheral edema, ascites. Peripheral edema, ascites. Peripheral edema, ascites. Jugular vein distension. Jugular vein distension. Jugular vein distension. Hepatomegaly. 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 How to diagnose heart failure? Echocardiogram. 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 Nursing considerations. Monitor daily weight, input and output. Monitor daily weight, input and output. Monitor daily weight, input and output. Sit patient upright, high Fowlers. Administer oxygen. Sit patient upright, high Fowlers. Administer oxygen. Sit patient upright, high Fowlers. Administer oxygen. Restrict fluid and sodium intake. Restrict fluid and sodium intake. Restrict fluid and sodium intake. Monitor for complications. Monitor for complications. Monitor for complications. Peripheral bypass graft is a surgery to restore blood flow to the extremity due to PAD. Blood supply is rerouted around the blocked artery in the leg. Nursing considerations for post-op. Closely monitor pedal pulses. Closely monitor pedal pulses. Closely monitor pedal pulses. Capillary refill, skin color. Capillary refill, skin color. Capillary refill, skin color. Check temperature. Check temperature. Check temperature. Patient needs to keep legs straight for 24 hours after surgery. Patient needs to keep legs straight for 24 hours after surgery. Patient needs to keep legs straight 24 hours after surgery. Complications: graft occlusion, signs and symptoms, pallor, pedal and decrease in pedal pulses. Pallor and decrease in pedal pulses. Pallor and decrease in pedal pulses. Temperature and increase in pain. Temperature and increase in pain. Temperature and increase in pain. Compartment syndrome. Signs and symptoms include numbness and pain with passive movement. Numbness and pain with passive movement. Numbness and pain with passive movement. Edema. 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 Taut skin. Taut skin. Pout skin. Patient teaching for peripheral artery disease. Walk until the point of pain. Walk until the point of pain. Walk until the point of pain. Stop and rest, then walk a little more. Stop and rest, then walk a little more. Stop and rest, then walk a little more. Avoid crossing legs and restrictive clothing. Avoid crossing legs and restrictive clothing. Avoid crossing legs and restrictive clothing. Maintain a warm environment. Wear socks. Maintain a warm environment. Wear socks. Maintain a warm environment. Wear socks. Avoid cold, stress, and caffeine. Avoid cold, stress, and caffeine. Avoid cold, stress, and caffeine. Avoid nicotine. Avoid nicotine. Avoid nicotine. We're going to go on to pacemakers. It's a device that provides electrical stimulation of the heart when natural pacemaker in the heart doesn't maintain proper rhythm. Types of pacing. Atrial pacing, used with SA node failure. Atrial pacing, used with SA node failure. Atrial pacing, used with SA node failure. Ventricle pacing, used with complete AV shock. Ventricle pacing, used with a complete AV block. Ventricle pacing, used with a complete AV block. Ventricle pacing, used with a complete AV block. AV pacing, used with SA node failure and a complete AV block. AV pacing, used with SA node failure and a complete AV block. AV pacing, used with SA node failure and a complete AV block. Pacemaker modes. Asynchronous, fires at a constant rate regardless of heart's electrical activity. Asynchronous, fires at a constant rate regardless of the heart's electrical activity. Asynchronous, fires at a constant rate regardless of the heart's electrical activity. Synchronous demand pacemaker, fires only when the heart's intrinsic rate falls below a certain rate. Synchronous demand pacemaker, fires only when the heart's intrinsic rate falls below a certain rate. Synchronous demand pacemaker, fires only when the heart's intrinsic rate falls below a certain rate. We're going to now go on to aneurysms. It's a balloon-like bulge in the arterial wall. Risk factors: white older males, white older males, white older males. Atherosclerosis, 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 atherosclerosis. Hypertension, hypertension, hypertension. Hypocholesterolemia, hypercholesterolemia, hypercholesterolemia. Smoking, smoking, smoking. Marfan syndrome, Marfan syndrome, Marfan syndrome. Signs and symptoms may be symptomatic, found during routine tests. Signs and symptoms may be symptomatic, found during routine tests. Signs and symptoms may be asymptomatic, found during routine tests. Signs and symptoms: abdominal aortic aneurysm, AAA, flank back pain. Flank back pain. Flank and back pain. Pulsating abdominal mass with bruits. Pulsating abdominal mass with bruits. Pulsating abdominal mass with bruits. Do not palpitate due to risk for rupture. Do not palpitate due to risk for rupture. Do not palpitate due to risk for rupture. And another sign and symptoms of aneurysm is thoracic aortic aneurysm. Severe back chest pain. Severe back chest pain. Severe back chest pain. Shortness of breath. Shortness of breath. Shortness of breath. Dysphagia and cough. Dysphagia and cough. Dysphagia and cough. Dysphagia and cough. We're going to go on to Buerger's disease. It's an inflammatory condition that impairs circulation to the extremities. Progression can lead to tissue death, gangrene, and amputation. Risk factors: smoking, male 20 to 50 years old. Risk factors: smoking, male 20 to 50 years old. Risk factors: smoking, male 20 to 50 years old. Signs and symptoms: claudication, numbness and tingling. Claudication, numbness and tingling. Claudication, numbness and tingling. A decrease in temp and pulses. A decrease in temp and pulses. A decrease in temp and pulses. Cyanosis in extremities. Cyanosis in the extremities. Cyanosis in the extremities. Patient teaching: stop smoking, avoid extreme cold. 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 We're going to go on to next now is anemia, which is a blood disorder causing a deficiency in RBCs or hemoglobin. Anemia, blood loss, GI bleeding, most common, trauma, menorrhagia. Blood loss, GI bleeding, trauma, menorrhagia. Blood loss, GI bleeding, trauma, menorrhagia. Iron deficiency anemia. Insufficient intake or poor absorption of iron. Insufficient intake or poor absorption of iron. Insufficient intake or poor absorption of iron. Common in children and during pregnancy. Common in children and during pregnancy. Common in children and during pregnancy. Vitamin deficiency anemia. Insufficient intake of folic acid or vitamin B12. Insufficient intake of folic acid or vitamin B12. Insufficient intake of folic acid or vitamin B12. Pernicious anemia. Lack of intrinsic factor in the gastric mucosa. Pernicious anemia. Lack of intrinsic factor in the gastric mucosa. Pernicious anemia. Lack of intrinsic factor in the gastric mucosa. Aplastic anemia. Bone marrow damage due to cancer. Bone marrow damage due to cancer. Bone marrow damage due to cancer. Also autoimmune disorders and medications. Autoimmune disorders and medications. Autoimmune disorders and medications. Hemolytic anemia. Destructions of RBCs due to genetic disorders. Destruction of RBCs due to genetic disorders. Destruction of RBCs due to genetic disorders. Infections, autoimmune disorders, medications. Infections, autoimmune disorders, medication. Infections, autoimmune disorder, medications. Signs and symptoms: shortness of breath and pallor. Shortness of breath and pallor. Shortness of breath and pallor. Fatigue, weakness, tachycardia. Fatigue, weakness, tachycardia. Fatigue, weakness, tachycardia. Sickle cell anemia. It's a genetic disorder that causes chronic anemia, pain, infection, and organ damage. Risk factors: family history, African Americans. Family history, African Americans. Family history, African Americans. And Middle Eastern descent. Middle Eastern descent. Middle Eastern descent. Signs and symptoms: pain, fatigue, shortness of breath. Pain, fatigue, shortness of breath. Pain, fatigue, shortness of breath. Pallor and jaundice. Pallor and jaundice. Pallor and jaundice. Types of sickle cell crises: vaso-occlusive crisis, severe pain, swelling of hands and feet. Severe pain, swellings of hands and feet. Severe pain, swelling of hands and feet. Splenic sequestrian crisis, splenomegaly, hypovolemic shock. Splenomegaly, hypovolemic shock. Splenomegaly, hypovolemic shock. Aplastic crises, severe anemia due to viral infection. Severe anemia due to viral infection. Severe anemia due to viral infection. Acute chest syndrome, dyspnea, fever, cough. Dyspnea, fever, cough. Dyspnea, fever, cough. Hyperhemolytic crisis, a rapid decrease in HGB levels. A rapid decrease in HGB levels. A rapid decrease in HGB levels. Nursing care, administer IV fluids, oxygen, and blood. Administer IV fluids, oxygen, and blood. Administer IV fluids, oxygen, and blood. Patient teaching, adequate fluid intake and rest. Adequate fluid intake and rest. Adequate fluid intake and rest. Prevent infection. Prevent infection. Prevent infection. Now we're going to go on to acid-base imbalances. We're going to start with metabolic alkalosis, pH of 7.45 and an HCO3 of 28. Causes: antacid overdose. Signs and symptoms: tachycardia, dysrhythmias. Signs and symptoms: tachycardia, dysrhythmias. Signs and symptoms: tachycardia, dysrhythmias. Muscle weakness, lethargy. Muscle weakness, lethargy. Muscle weakness, lethargy. Then we're going to go on to metabolic acidosis, where we have a pH of 7.35 and an HCO3 of 21. It's caused by DKA and kidney failure. Signs and symptoms: hypotension, tachycardia. Hypotension, tachycardia. Hypotension, tachycardia. Weak pulses, dysrhythmias. Weak pulses, dysrhythmias. Weak pulses, dysrhythmias. Kussmaul respirations, fruity odor breath. Kussmaul respirations, fruity odor breath. small respirations, fruity odor breath. Warm, flushed skin. Warm, flushed skin. Warm, flushed skin. For respiratory alkalosis, we're still on acid-base imbalances. We have a pH of 7.45 and a PaC of 35. Signs and causes is hyperventilation due to fear or anxiety. Signs and symptoms, shortness of breath and dizziness. Signs and symptoms, shortness of breath and dizziness. Signs and symptoms, shortness of breath and dizziness. Anxiety and chest pain. Anxiety and chest pain. Anxiety and chest pain. Numbness in the hands and feet. Numbness in the hands and feet. Numbness in the hands and feet. Respiratory acidosis, a pH of 7.35 and a PaCO2 of 45. Signs and symptoms, confusion and lethargy. Confusion and lethargy. Confusion and lethargy. Dyspnea and pale cyanotic skin. Dyspnea and pale cyanotic skin. Dyspnea and pale cyanotic skin. Ineffective endocarditis. It's an infection of the endocardium, inner layer of the heart. Risk factors: congenital heart disease, congenital heart disease, congenital heart disease, valvular heart disease, valvular heart disease, valvular heart disease, prosthetic valve, prosthetic valve, prosthetic valve. IV drug use is major. IV drug use is major. IV drug use is major. Signs and symptoms: fever and flu-like symptoms. Fever and flu-like symptoms. Fever and flu-like symptoms. Murmur and pediche. Murmur and pediche. Murmur and pediche. Splinter hemorrhages is major. Splinter hemorrhages is major. Splinter hemorrhages is major. That's red streaks under the nail beds. Cardioversion. Types of cardioversion. Electrical. Synchronized cardioversions is the use of electrical shocks delivered at the peak of the QRS complex to restore normal heart rhythm. Defibrillation is the use of unsynchronized electrical cardioversion in an emergency situation. And then you have chemical cardioversion, use of medications to restore normal heart rhythm. Now, you're going to notice in some of my readings, I really don't read what the issue is. I don't tell you what it is because this is basically a channel for the signs and symptoms and the risk factors and the patient education that is repeated over and over because those are the pieces that are missed. And I feel like if you hear it more than once, I know that if you hear it more than once, you will do better and the information will stay. So for nursing considerations for types of cardioversion, the patient should be on anticoagulation for 3 weeks prior to the procedure. The patient should be on anticoagulation for 3 weeks prior to the procedure. The patient should be on anticoagulation for 3 weeks prior to the procedure. The patient should be on anticoagulation for 4 weeks after cardioversion. The patient should be on anticoagulation for 4 weeks after cardioversion. The patient should be on anticoagulation for 4 weeks after cardioversion. For electrical cardioversion, stand clear while electric shock is delivered. Stand clear while electric shock is given. Stand clear while electric shock is given. After procedure, ensure patient airway. After procedure, ensure patent airway. After procedure, ensure patent airway. Monitor VS, obtain EKG. Monitor VS, obtain EKG. Monitor VS, obtain EKG. Monitor for signs and symptoms of dislodged clot. Monitor for signs and symptoms of dislodged clot. Monitor for signs and symptoms of dislodged clot. Valvular heart disease. A cardiac valve dysfunction, aortic, mitral, tricuspid, or pulmonary. Risk factors: hypertension, older age. Hypertension, older age. Hypertension, older age. Smoking. Hypercholesterolemia. Smoking. Hypercholesterolemia. Smoking. Hypercholesterolemia. Diabetes. Rheumatic heart disease. Diabetes. Rheumatic heart disease. Diabetes. Rheumatic heart disease. Ineffective endocarditis. Ineffective endocarditis. Ineffective endocarditis. Signs and symptoms: murmurs and extra heart sounds. Murmurs and extra heart sounds. Murmurs and extra heart sounds. Arrhythmias, dyspnea with mitral stenosis. Arrhythmias, arrhythmias, arrhythmias. Dyspnea with mitral stenosis or insufficiency. Dyspnea with mitral stenosis or insufficiency. Dyspnea with mitral stenosis or insufficiency. Patient teaching. Prophylactic antibiotics. Prophylactic antibiotics. Prophylactic antibiotics. Make sure you take them before dental work, surgery, or invasive procedures. Take it before dental work, surgery, or invasive procedures. Take it before dental work, surgery, or invasive procedures. Now we're going to go on to genetic coagulation disorders. Hemophilia, which is a rare inherited bleeding disorder that results in a deficiency of clotting factors. Hemophilia A equals a deficiency of factor 8. Hemophilia B is a deficiency of factor 9 or 11. It's 1X. So we're just going to go with 1X. My brain is kind of blank on numerical Roman numerals right now. So it's 1X for deficiency of factor. Von Willebrand's disease, VWD, is a hereditary bleeding disorder that causes deficiency of clotting factor. It's VWF. And impaired platelet function. 3 major types. Type 1 is most common. And the treatments for both of hemophilia and von Willebrand's disease is factor replacement. We're going to go on to peripheral artery disease, PAD, which is an inadequate blood flow to the lower extremities. Risk factors: hypertension, diabetes. Hypertension, diabetes. Hypertension, diabetes. Smoking, obesity. Smoking, obesity. Smoking, obesity. Hyperlipidemia. hyperlipidemia, hyperlipidemia. Signs and symptoms of peripheral artery disease: intermittent claudication, intermittent claudication, intermittent claudication. Ischemic leg pain with exertion, ischemic leg pain that increases with exertion, ischemic leg pain that increases with exertion. Decrease with dangling, decrease with dangling, decrease with dangling. Cool, shiny skin, cool, shiny skin, cool, shiny skin. Pallor with elevation, pallor with elevation, pallor with elevation. Dependent rubor, dependent rubor, dependent rubor. Delayed capillary refill, delayed capillary refill, delayed capillary refill. Decrease in pedal pulses, decrease in pedal pulses, decrease in pedal pulses. Lack of hair on calves, lack of hair on calves, very important. Lack of hair on calves, very important. Lack of hair on calves, very important. Thick toenails, thick toenails, thick toenails. Dry necrotic issue on the toes, dry necrotic issue on the toes. Dry necrotic issures or eschar on the toes, eschar, eschar. I'm probably butchering it, but eschar. Delayed wound healing. This is signs and symptoms of peripheral arterial disease. Delayed wound healing. Delayed wound healing. Delayed wound healing. We're now going to go on to hypertension. Signs and symptoms: asymptomatic, asymptomatic, asymptomatic. Nursing care. Signs and symptoms: headache, chest pain, headache, chest pains, headache, chest pains. Shortness of breath, dizziness, shortness of breath, dizziness, shortness of breath, dizziness. Monitor for hypertensive crisis, monitor for hypertensive crisis. Monitor for hypertensive crisis. Patient teaching: the DASH diet. Fruits, veggies, whole grain, low-fat dairy, salt and fat. DASH diet. DASH diet. DASH diet. Increase fruits, veggies. Increase fruits and veggies. Increase fruits and veggies. Increase whole grains, low-fat dairy. Increase whole grains, low-fat dairy. Increase whole grains and low-fat dairy. Decrease salt and fat. Decrease salt and fat. Decrease salt and fat. Weight reduction, stress reduction. Weight reduction, stress reduction. Weight reduction, stress reduction. Smoking cessation, smoking cessation, smoking cessation. Limit alcohol consumption, limit alcohol consumption, limit alcohol consumption. Take blood pressure regularly at home. Take blood pressure regularly at home. Take blood pressure regularly at home. We're now going to go on to atrioventricular blocks, AV blocks. First degree AV block, prolonged impulse conduction time from the atria to the ventricles due to a delay in the AV node. First degree AV block, prolonged impulse conduction time from the atria to the ventricles due to a delay in the AV node. First degree AV block, prolonged impulse conduction time from the atria to the ventricle due to a delay in the AV node. Second degree type 1 AV block, progressive, an increase in impulse conduction time between the atria and ventricles until one impulse fails to conduct. Second degree type 1 AV block, progressive increase in impulse conduction time between the atria and ventricles until one impulse fails to conduct. Second degree type 1 AV block, progressive increase in impulse conduction time between the atria and ventricles until one impulse fails to conduct. Second degree type 2 AV block, sudden failure of impulse conduction from atria to the ventricles without a progressive increase in conduction time. Second degree type 2 AV block, sudden failure of impulse conduction from the atria to the ventricles without a progressive increase in conduction time. Second degree type 2 AV block, sudden failure of impulse conduction from the atria to the ventricles without progressive increase in conduction time. This treatment here is pacemaker. Okay? Third degree AV block, complete failure of all impulse conduction from the atria to the ventricles. Third degree AV blocks, complete failure of all impulses conduction from the atria to the ventricles. Third degree AV block, complete failure of all impulses conductions from the atria to the ventricles. We're now going to go on to the atherosclerosis. Atherosclerosis, which is a buildup of plaque on the atrial walls. Risk factors: hypertension and aging. Hypertension and aging. Hypertension and aging. Smoking and hypercholesterolemia. Smoking and hypercholesterolemia. Smoking and hypercholesterolemia. Family history of diabetes and obesity. Family history of diabetes and obesity. Family history of diabetes and obesity. Signs and symptoms. Asymptomatic early. Asymptomatic early. Asymptomatic early. Angina and fatigue. Angina and fatigue. Angina and fatigue. Weakness and hypertension. Weakness and hypertension. Weakness and hypertension. Bruits late. Bruits late. Bruits late. Patient teaching. Smoking cessation, weight loss. Smoking cessation, weight loss. Smoking cessation, weight loss. Exercise, heart healthy diet. Exercise, heart healthy diet. Exercise, heart healthy diet. We're down to the last few here. We are almost done with the cardiovascular system. This is one of the biggest ones in the deck. It is the biggest one. So you guys got good stuff here. You can use this information, study for your NCLEX. You can study for your exit exams. You can study for your weekly tests. But instead of sitting there and listening to a professor read from a book for 6 hours online or read from a paper, and if you have learning disabilities and ADHD, you have to go back for 6 hours and listen to that, and you still might not get it. So you might have to go back for another 6 hours, and that's 18 hours gone. And then you have to go on YouTube because there's so much, and hope that you can find something to fill in the blanks. So what I love about what I'm doing here is that I'm repeating the signs, the symptoms, and I'm repeating the nursing care and the patient education, because these are the pieces. And of course, if there's contradictions, I'm repeating those too, because you're going to see these over and over and over again. All right, let's keep going. Cardiac tamponade. Compression of the heart due to the accumulation of fluid in the pericardial sac. Signs and symptoms: hypotension, muffled heart sounds. Hypotension, muffled heart sounds. Hypotension, muffled heart sounds. Jugular vein distension and paradoxal pulse. Jugular vein distension and paradoxal pulse. Jugular vein distension and paradoxal pulse. Electrical alternans. Electrical alternans. Electrical alternans. Dyspnea, fatigue. Dyspnea, fatigue. Dyspnea, fatigue. An important sign and symptom is a paradoxal pulse. Important sign and symptoms is a paradoxal pulse. Important sign and symptoms is a paradoxal pulse. We're going to go on now to rheumatic heart disease, which is heart valve damage caused by rheumatic fever. Signs and symptoms: tachycardia, cardiomegaly. Tachycardia, cardiomegaly. Tachycardia, cardiomegaly. Murmur, friction rub. Murmur, friction rub. Murmur, friction rub. Chest pains. Chest pains. Chest pains. Now we're on to pericarditis, which is inflammation of the pericardium, the sac that surrounds the heart. Signs and symptoms: very important, chest pain. Very important, chest pains. Very important, chest pains. Very important, friction rub. Very important, friction rub. Very important, friction rub. Fever, dysrhythmias. Fever, dysrhythmias. Fever, dysrhythmias. Dyspnea. 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 Nursing considerations: monitor for complications. Monitor for complications. Monitor for complications. The next one we're going to go on to is coronary artery bypass graft. That's CABG. It's a surgery to bypass one or more coronary arteries due to blockage or persistent ischemia, using the patient's own blood vessels or synthetic grafts. Nursing care for post-procedure. Monitor patient's BP. Monitor patient's BP. Monitor patient's BP. Hypertension can cause bleeding from the graft. Hypertension can cause bleeding from the graft. Hypertension can cause bleeding from the graft. Hypotension can cause collapse of graft. Hypotension can cause collapse of graft. Hypotension can cause collapse of graft. Monitor body temperature. Monitor body temperature. Monitor body temperature. Treat hypothermia with rewarming. Treat hypothermia with rewarming. Treat hypothermia with rewarming. Monitor for bleeding. Monitor for bleeding. Monitor for bleeding. This is important. Notify provider for chest tube drainage of 150 mLs an hour. Notify, important, provider for chest tube drainage of 150 mLs per hour. Notify provider for chest tube drainage of 150 mLs per hour. Monitor levels of consciousness. Monitor levels of consciousness. Monitor levels of consciousness. Fluid and electrolyte balance. Fluid and electrolyte balance. Fluid and electrolyte balance. Cardiac rhythm, pain level. Cardiac rhythm, pain level. Cardiac rhythm, pain level. Neurovascular status of donor site. Neurovascular status of donor site. Neurovascular status of donor site. Monitor for complications. Monitor for complications. Monitor for complications. We're going to go on now to percutaneous coronary intervention. That's PCI. Minimally invasive procedure used to open blocked coronary arteries. Minimally invasive procedure used to open blocked coronary arteries. Let me repeat that. It's a minimally invasive procedure used to open blocked coronary arteries. Nursing condition. Monitor for bleeding at insertion site. Monitor for bleeding at insertion site. Monitor for bleeding at insertion site. Check perfusion to extremity distal to insertion. Check perfusion to extremity distal to insertion site. Check perfusion to extremity distal to insertion site. Monitor for complications. Monitor for complications. Monitor for complications. Monitor for artery dissection and thrombosis. Monitor for artery dissection and thrombosis. Monitor for artery dissection and thrombosis. Reocclusion of vessel. Reocclusion of vessel. Reocclusion of vessel. Now we're on to polycythemia. It's a rare blood disease that causes an increase in red blood cells. Signs and symptoms: plethora, ruddy complexion. Plethora, ruddy complexion. Plethora, ruddy complexion. Nail clubbing. Nail clubbing. Nail clubbing. Dizziness, fatigue, headache. Dizziness, fatigue, headache. Dizziness, fatigue, headache. Splenomegaly, hypertension. Splenomegaly, hypertension. Splenomegaly, hypertension. We're going on to cardiomyopathy. It's a disease of the cardiac muscle. Main types: dilated, hypertrophic, and restrictive. Dilated is the most common. Ventricles enlarging and weaken. Ventricles enlarging and weaken. Ventricles enlarging and weakening. Starting with the left ventricle. Starting with the left ventricle. Starting with the left ventricle. Affecting systolic function. Affecting systolic function. Affecting systolic functions. Hypertrophic. Ventricles and septum enlarge and thicken. Ventricles and septum enlarge and thicken. Ventricles and septum enlarge and thicken. This affects diastolic function and obstruct outflow. This affects diastolic function and obstructs outflow. This affects diastolic function and obstructs outflow. And last but not least, in cardiomyopathy is restrictive. Ventricles become stiff and rigid. Ventricles become stiff and rigid. Ventricles become stiff and rigid. Restricting filling during diastole. Restricting filling during diastole. Restricting filling during diastole. Now we're going to go on to sodium. It's an electrolyte essential for maintenance of fluid balance, nerve, muscle function. Signs and symptoms. Thirst and lethargy. Thirst, important. Thirst. Lethargy. Confusion is important. Confusion. That's very important. GI upset and muscle twitching. GI upset and muscle twitching. GI upset and muscle twitching. Seizures, important. Seizures. Irritability and agitation. Irritability and agitation. Irritability and agitation. So this is what I just read was for hypernatremia. That's 145. That's high sodium. High sodium. Now we're going to talk about hyponatremia, which is low sodium. Signs and symptoms, which is very important. Confusion. And it's common in the elderly. Fatigue and NV. Fatigue N/V. Fatigue N/V. Headache. Very important. Seizures. We're going to go on now to potassium, which is the electrolyte essential for maintenance of ICF, nerve and muscle function. Hyperkalemia, which is high potassium. Potassium values run between 9 to 10.5. Right now, anything over 10.5, we got a problem. Signs and symptoms of potassium. Dysrhythmias, important. Dysrhythmia, ATI importance. Dysrhythmias. Muscle twitching and weakness. Muscle twitching and weakness. Paresthesia. Diarrhea. Just for a hint, you're going to treat potassium with furosemide. And insulin. It's very important. Now we're going to go on to low potassium. I said it was 9 to 10.5. It's not. It's 3.5 to 5. So ignore that. It's not. I'm thinking of calcium, which is 9 to 10.5. This is potassium, which is from 3.5 to 5. So what I just read you was for hyperkalemia, that's anything over 5. So just remember that. I just read anything over 5. Hyperkalemia. For potassium, it's 3.5 to 5. I want to clarify that. Now we're going to talk about hypokalemia, and that's from 3.5 and less. Signs and symptoms. Dysrhythmias. Important. Dysrhythmias. Very important. Dysrhythmias. Muscle weakness and constipation ileus. Hypotension and weak pulses. Hypotension and weak pulses. Hypotension and weak pulses. And for treatment, you're going to monitor the heart. Monitor the heart. Monitor the heart. And last but not least, in our cardiac med-surg completion is magnesium, which is an electrolyte essential for muscle nerve function, biochemical reactions. Hypermagnesium is anything over 2.1 because the normal rate for magnesia is 2.1 to 1.3. Okay? Hypermagnesia is caused by kidney disease. Kidney disease. Kidney disease. Signs and symptoms: hypotension and lethargy. Hypotension and lethargy. Hypotension and lethargy. Muscle weakness. Muscle weakness. Muscle weakness. A decrease in DTRs. A decrease in DTRs. A decrease in DTRs. That is important. That is important. A decrease in DTRs. Respiratory depression is important. Respiratory depression is important. Respiratory depression is important. Dysrhythmias and cardiac arrest. Dysrhythmias and cardiac arrest. Dysrhythmias and cardiac arrest. Now we're going to go on to hypomagnesia. Magnesia, which is anything below 1.3. Again, the normal rate for magnesium is 1.3 to 2.1. It's caused by GI losses. Signs and symptoms: dysrhythmias. 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 This is important. Torsadas de pointes. Torsadas de pointes. Torsadas de pointes. That's very important. That's an ATI question. Tachycardia and hypertension. Tachycardia and hypertension. Tachycardia and hypertension. Tremors and seizures. Tremors and seizures. Tremors and seizures. And an increase, this is important, in DTRs. Increase in DTRs. An increase in DTRs. This is hypomagnesia. Anything under 1.3. For hypermagnesium, it was a decrease in DTRs. That's important, is the DTRs. This completes the biggest section of med-surg, cardiovascular. Happy studying.